Thank you.
Joy to the world.
Yes.
You are here.
I'm here.
Talking, and I gotta just, it's a wonderful thing you're talking about oral hygiene because you have a beautiful smile.
I try.
I just think it's like you go to a dentist, you see your hygienist.
Yeah, you want to make sure that the provider at least takes care of their
Exactly.
teeth.
You're already feeling more confident. CCI Health and Wellness. We've had a number of people from CCI here. We've touched a little bit on the dentistry on the world. Tell us a little bit about what your segment of CCI Health and Wellness does in looking after people's oral hygiene.
Well, my segment is primarily about educating patients. A lot of times parents just don't know what they don't know. And so we do our very best to inform our patients at a very early age, at 6 months. So we typically recommend that children come to see the dentist at about 6 months of age so that we can begin to educate the parent about how to take care of their teeth, because we know that prevention actually saves money and it works. We know exactly how tooth decay develops, and we're able to actually provide tools for parents to prevent that from occurring.
I know a lot of questions here from everybody, but let me just quick question.
Yes.
Your CCI Health and Wellness looks after the part of the community that can't afford health care.
Right.
And a lot of immigrants, a lot of undocumented, a lot of poor folks. What are the major issues that you find with dental care in terms of people in the education, that brushing is not enough, or people coming from countries where they're not brushing? What's the...
Well, at the Franklin Park location where I work, we actually have a refugee program. So we are actually getting some low-income patients that are coming from other countries, immigrants, and then we're also getting some of the refugees, and it really just depends. It varies. Some patients do brush their teeth, they just don't know how to brush their teeth properly, and it's it's not as simple as just putting toothpaste on a toothbrush and moving. You have to make sure that you're actually brushing the appropriate areas in your mouth to make sure that you're actually accessing the places where the bacteria most likely is going to reside. So a lot of the...
How do you reach this community in terms of actually approaching this community? How you're volunteering?
I think because we are already in the community, a lot of the patients already know about CCI. For example, the Franklin Park location that I work in, it's actually in the community. The apartment homes are surrounding the location, so they know we're there, and we do a lot of outreach to the community to let them know that we do have services that will provide both primary care, mental health, prenatal care, oral health. So yeah, we reach out in that way because we're right there where they are.
And how are you funded?
Yeah,
we are federally funded. We receive government funding, and then also we get reimbursements from Medicaid, and because we do accept Medicaid. For those who don't have insurance, we actually provide a sliding scale, which means that they will bring in proof of income, and then we would let them, based on that, we will determine what scale they fall under. For example, for a patient who needs a regular cleaning, the lowest scale is $35. So it's pretty reasonable. We try to be as reasonable as we can.
What do you see the extent of the problem of this in the county?
From my perspective, I think that it's a lot more prevalent in both gum disease and dental decay. I know the CDC reports that about 50% of Americans have periodontitis, which is the type of gum disease where you're actually starting to lose bone and you're starting to have bleeding and your gums are receding, and it's much more aggressive. So it's really surprising to find that 1 in every 2 people, have periodontal disease. Yes, very significant.
But some of that's from too hard brushing too.
Yes, hard brushing. Being aggressive can definitely.
No aggressiveness.
You want to use a soft toothbrush too, because most patients are like, no, I need to use that hard toothbrush. It's the only way.
I've been lectured.
Yeah.
When you see people who come from other countries, do you notice a difference because they may or may not have been exposed to fluoride in their water? Do you see that?
That could definitely be. A lot of times patients from other countries, they actually report that they are added. They're given like fluoride supplements. So it doesn't come in their water, but maybe their doctors prescribe a pill or something that they may have taken to supplement the difference.
We have 40 seconds left.
40 seconds left. I would just say, if you haven't been to the dentist, please go to the dentist. We would love to, CCI would love to partner with you in your oral health care. So.
And if they come to Franklin, are they going to see you?
They'll see me. I'll be right there. Absolutely.
Do you feel like you're making progress?
I do. I think that every day we see patients that are improving their oral health care. We see patients that sometimes we can't treat them within our center, and we have wonderful community partners that they're able to receive the care. And I've seen kids that have come back to us who started off with almost every tooth with cavities, and they've come back and everything has been resolved. So
with a big smile.
With a big smile, absolutely.
Well, Joy, you leave us on a joyful note.
Thank you so much.
Thank you so much. We'll be right back after these messages.